Hi, so welcome to GHAPPcast, the official podcast of Gastroenterology and Hepatology Advanced Practice Providers. I'm your host, Gabriella McCarty. I'm a nurse practitioner at North Shore Gastroenterology. It's a large private practice in the Cleveland area, and I have been there for the past 25 years. I do general GI, IBD, and hepatology, so a little of everything across the board. So thank you for joining us for another insightful episode where we dive deep into the world of GI and hepatology. So today's episode is entitled Biosimilars Unveiled, Empowering APPs for Better Patient Conversations, focuses on enhancing our ability to educate and discuss biosimilars with our patients. We're going to explore the crucial role advanced practice providers play in patient education and how we can effectively communicate the benefits and considerations of biosimilars. So joining me today is Tedra Gray. She's a nurse practitioner and a seasoned expert in the field. Welcome, Tedra. Can you tell me a little bit about yourself?
Thank you so much, Gabriella. I'm excited to be here. Yes, my name is Tedra Gray. I'm a nurse practitioner in the GI space. I've been practicing as an advanced practice provider in general GI for about 20 years. And it's a dual role, inpatient and outpatient. So I see a plethora of presentations from different perspectives in regards to general GI diagnoses, and have perfected or kind of honed my skills over time in this space to really kind of feel as though our patients are getting cutting edge, evidence-based practice, treatment plans, and I'm just excited to continue to grow and evolve as the landscape is changing.
Thank you so much. We're so glad to have you. So together we'll share the hurdles we've encountered in our practice related to biosimilars. We'll discuss strategies to overcome some of these challenges and answer some of the most common questions that we receive from patients and questions that we've also gathered from you, our listeners. So whether you're on your commute, taking a break, or tuning in from your clinic, get ready to gain new insights and tools to help you have more meaningful and effective conversations with your patients about biosimilars. So let's get started, Tedra. One question that we get often is, what exactly is a biosimilar? Is it the same as a generic drug? How do you answer that?
Oh, of course, Gabriella. Biosimilars are not the same as generic drugs. As their name states, they are similar, but they're not identical versions of biologic drugs. And so biologics are medications made from living organisms or cells and are often used to treat complex diseases like the ones that we deal with in gastroenterology. And biosimilars are deeply and highly similar to what's already been approved as a biologic drug. And it's also known as the reference product. So there's no clinical and meaningful difference in the safety, purity, or potency of the medication. So alternatively, generic medications are essentially copies of brand name drugs that have almost the same active ingredients, intended use, as well as dosage, forms, and route of administration. And they're approved by regulatory authorities such as the FDA once the patent for the original brand drug has been expired.
Great. That's a good answer to that question. I don't think I have anything else to add to that. Patients do ask, why would I want to do this? Why do I want to switch to a biosimilar? What are the benefits in gastroenterology?
I would say why you would want to switch to a biosimilar is there's several reasons. The short answer is pretty much that they work in the same way. They're administered in the same way as the reference product. But however, let's kind of unpack that a little bit further. So the benefit of using a biosimilar in the GI space for the patient's perspective, it increases your access to care. The patient is really the stakeholder in this scenario from that perspective. So it's important that, especially for the population that I serve at my organization, that may not be have as much commercial insurance, increasing access to care is essential. And then second reason is cost. and the savings from the patient's perspective, as well as from the insurance and or the payer standpoint. So let me just set the framework for this concept. So on average, the reference product, the biologic, has exclusivity in the market for about 12 years. And after that period, biosimilars can then emerge. So biosimilars come in at about, let's say, 30% cheaper than the reference product. So once the biosimilar becomes available, competitive prices for the reference product and the biosimilar, a price war begins. And so the reference product has to stay relevant and viable option for insurance companies. So according to the 2023 U.S. Generic and Biosimilar Net Savings Report, biosimilars estimated about $23.6 billion in saving costs since 2015, which is about a $10 billion increase from just 1 year ago. So it's coming in cheaper. It's allowing for a greater savings. So that's why the patient wants to use it. And so then let's reflect back on that access to care, that access issue that a lot of patients encounter. So the exciting component is that biosimilars have been used in about 694 million patient days of therapy and in 344 million incremental days of therapy. So that's the most important takeaway, is that this number continues to rise. So our patients are getting benefit from it. You're getting access to it. It's more available. And so that's why patients will want to use it.
That's great. And that's a huge cost savings. I didn't even realize it was that much. So yeah, it's same thing I say, it is more cost effective. And even though the population I see is a lot of commercially insured patients, it is important to be transparent with how much these medications are. Even if it's not coming out of your own pocket, it is coming out of your insurance. It's coming out of somebody's pocket. So just to have these available and getting patients treated faster is so important. So another question is, are they safe? Are biosimilars safe? Are there any different side effects that we would expect?
Absolutely. Yes, biosimilars are safe. They have been extensively studied and they provide the same efficacy and safety as the reference product. So they can be given to treatment experienced patients and or treatment naive patients. And then biosimilars, as well as interchangeable biosimilars, have the same degree and amount of immunogenic response as the reference product. So yes, I definitely tell my patients that they are safe and that the side effects, that we are familiar with them, and we will walk through this journey together.
Right, that's great. So how are they tested?
So this is very, very extensive and very, very on a higher level or clinical chemistry level. So developing and testing a biosimilar involves a complex and rigorous process. And so when it's compared to small generic molecules. And it's extensively analytically studied in 4 key elements. So of physical chemical properties, as well as primary and higher order protein structures, biological activities, and impurity profiles of the biosimilar and the reference product. So after a lot of or extensive amount of non-clinical studies are conducted to assess the similarity and safety of the biosimilar, these studies may include like in vitro tests to evaluate the biological activity, binding affinity, as well as the mechanism of action of the biosimilar compared to the reference product. Then you have animal studies that are also performed to assess for pharmacokinetic, as well as toxicology, immunogenicity, as well as other relevant parameters. So then you compare clinical trials are conducted to establish like the similarity of the biosimilar to the reference product in terms of efficacy, safety, and immunogenicity. So these trials typically involve like a stepwise approach, starting with pharmacokinetic and pharmacodynamic studies to demonstrate equivalent exposure and responses compared to the reference product. And then subsequent clinical trials involving efficacy and safety assessments in patients often include specific disease populations for which the reference biological product is approved. So a simpler way to say this is that, yes, they go through an extensive process, but it's an abbreviated 351 pathway with the goal to demonstrate biosimilarity as well as interchangeability to the reference product based upon comparative assessments.
Thank you. That is a wealth of information there. So are there any resources for myself or for the patient to learn more about biosimilars? What do you recommend?
I recommend going to the source that authenticates and validates why we use specific drugs, and that will be the FDA. So there's a specific website, www.fda.gov/biosimilars. It's a great resource for patients, for education, and the website is also great for providers as well. And so I use the resource for their fact sheets to make sure I can manage my patients appropriately and aid in answering some questions or keeping me consistent with what the current guidelines are. And then there's also the Crohn's and Colitis Foundation, which is very helpful for both patients, caregivers, and clinicians, and has a wealth of information, resources, and dialogue.
Thank you. Yes, I reference the Crohn's Colitis Foundation often. And they also have some great information and letters of appeal if necessary, that you just pull up and you enter your patient information, and it has articles referenced and everything to give to the insurance company. So that is a great, great website, the Crohn's Colitis Foundation. So another question that we receive often are, from patients, will I notice any difference in how I feel or how the treatment works? Will it work just as well as what I'm taking now? How do you answer that?
Well, I generally say that the switch is, or what my experience has been, is that the switch has been a positive experience. And so there's no increase in risk of flare, loss of clinical remission, and zero difference in the risk of death and or adverse effects. However, I do attempt to go the extra mile in that if I know my patient is transitioning, to give them a call, to make that touch point, to just check in, to give them the opportunity to, have dialogue and discuss anything that they may be feeling. And I think that helps mitigate what anxiety might come from knowing that they're switching medication.
Yeah, that's helpful. I have not had issues with switching patients over, other than maybe one or two patients that really, really wanted the brand name product. So I don't know if, these were true side effects, but of course it didn't work as well for them, or they felt like they had side effects. Of course, then I appeal with the insurance company to get them back on the brand name if that is the case. But I would say, 98, 99% of my patients, no issues. And I tell them the same thing that you said. And I do follow up. And we do follow closely with our IBD patients, anybody on advanced therapy. I try to see back in the office every 6 months, no matter what, even if they're doing well. You really get to know your IBD patients so well, and I feel like you can catch some subtle changes with those visits.
Absolutely.
So what options are there if patients refuse to go on biosimilars? And I kind of just mentioned like my couple patients that I've had. What do you think?
Again, to your point, doing the appeal letter, kind of stating the case or advocating for the patient. And I think along with having that approach, kind of having the discussion to ensure that the patient understands that based upon the patient's insurance, and their state's ability to have like the interchangeability policies, that the patient knows that the insurance company and or the pharmacist may change it without having to ask us or to allow us to know. However, that the patient needs to be aware that that denial from the insurance coverage could delay getting a medication and or achieving remission and or causing a flare, which can impact the quality of life. And that if they are adamant about it, that then that higher out-of-pocket costs will come from the patient.
Yeah, and most patients do not want that, of course. But I feel like it is important to be transparent. I am fine with the pharmacy just changing the treatment, but we should let the patients know so it's not a big surprise when they're coming in for their infusions and they're not getting what they're used to getting. But yeah, so there are options of appeals. And a lot of times with insurance, we may have to jump through a couple hoops. We may have to jump through a couple treatments to get on what we want. And it's so different. Everybody's so different. treatment in IBD is certainly not black and white for sure.
Exactly.
So individualized.
Yeah.
So I think this is the last question here. So if I start with a biosimilar, can I switch back to the original biologic if it doesn't work for me?
Well, I would say this question is kind of like a specific to like an interchangeability biosimilar. So only a few biosimilars have that interchangeability to the reference product. So interchangeability really means that the biosimilar has met like some additional requirements and can be exchanged at the pharmacy per the state law. So usually if the interchangeable biosimilar is not meeting the clinical as well as the endoscopic and the histological targets, after use, you're going back to the original biologic, may not or really will not achieve any greater efficacy per se. So if we're really asking the question, could you just switch back because you're losing response, then we're kind of having a different issue than just saying, I want to go back to like the reference product.
Yeah, that's really helpful. And, drug monitoring comes into play here and everything, and that could be a whole different topic. But that was really helpful. Thank you for all that information. Is there anything else that you can think of at this point before we wrap up?
I would just say that biosimilars is the evolving landscape, and to continue working with our partners in the pharmacy space to ensure that, what is available, that we're continuing to be abreast of that new knowledge. And when you're working with an institution, ensure that what's on formulary for that institution so that we can make informed decisions as clinicians, as well as having those informed conversations with our patients.
Yeah, that's great. I feel like there's so much in the pipeline, and, some of them have, like adalimumab has how many different biosimilars. So it can get very confusing even for us as providers. I can't imagine how confusing that is for patients, right? But yeah, just keeping us abreast of all the knowledge and information that we can then pass on to patients is so important.
Okay.
All right. So as we wrap up today's episode, I would like to thank Tedra Gray for joining us and sharing such valuable insights. It was fantastic having you here.
Thanks, Gabriella. It was fantastic being here, and it was a pleasure really discussing this important topic with you and all of our listeners. And I hope we provided some helpful strategies, some useful tips, and answer some questions that can help empower our fellow APPs in this space and continue to keep the conversations going.
Great. And thank you to our listeners for tuning in and for submitting your questions. We hope that this episode helps you feel more equipped and confident in discussing biosimilars with your patients. So remember, you're not just providing care, you are educating, which is a vital part of our role. So please make sure to subscribe to GHAPPcast on your favorite podcast platform to stay updated with our latest episodes. And don't forget to explore the growing GHAPPcast, which is our rheumatology counterpart, and visit our informative website at GHAPP.org, so GHAPP.org, and connect with us on Twitter at GastroHepApp and Instagram at GastroHepApp for the latest updates, insightful content, and exciting announcements. So until next time, this is Gabriella McCarty signing off.